If your legs jolt you awake at night, if it feels like something is shorting out inside your own body, I need you to stop what you're doing and listen carefully, because what I'm about to share with you is something I have spent decades trying to get to the people who need it most. And the medical system keeps getting in the way. I'm not going to waste your time. I've spent years working with patients over 60, and I've watched too many of them suffer silently through something that had a real explanation the whole time. They came to me after years of being dismissed, after being told it was anxiety, after being handed a prescription and sent home, after lying awake at 3 in the morning wondering if they were losing their minds or losing their legs. You are not losing your mind, and you deserve to know what's actually happening. Let me ask you something directly. Do your legs or feet ever feel like they're being struck by electricity, especially at night? Not a dull ache. Not stiffness, an actual jolt, a sharp, sudden surge that shoots through your foot or calf and pulls you straight out of sleep. And then, nothing, no warning, no pattern, just that shock over and over, night after night. Maybe it's not just the shocks. Maybe your feet burn when you finally get into bed, like they're resting on a heating coil rather than a mattress. Maybe your toes feel numb during the day, but somehow the pain gets worse at night when you're lying still. Maybe you've started sleeping with your feet outside the blanket because the weight of the sheets is genuinely unbearable. Or maybe you've noticed that the bottoms of your feet feel distant, like they belong to someone else. If any of that sounds familiar, you are not alone. And this is not normal aging. I want you to hear that clearly. This is your body sending a specific signal. And today, I'm going to explain exactly what that signal means. In my years working with patients over 60, I've seen this particular pattern. The nighttime shocks, the burning, the numbness, destroy people's quality of life quietly and progressively. And the most painful part is this: the majority of them had no idea why it was happening. Their doctors either minimized it or treated it with medications that made them feel foggy, unsteady, and exhausted, without ever addressing the actual cause. And that's what I'm going to change today. Think about how this has affected your daily life. Maybe you used to walk in the morning, a simple ritual that kept you grounded, kept your mind clear, and slowly, without a dramatic single moment, you started skipping it. The feet didn't feel right. The balance wasn't there. You couldn't trust your own body on an uneven sidewalk, or a wet floor, or a step you didn't see clearly. So you stopped. And with that walk, something else disappeared too. A piece of your independence. Or maybe it's the sleep. Weeks, then months of fragmented nights. You fall asleep, and then, around 2 or 3 in the morning, that electric jolt pulls you awake, and you lie there in the dark, feet burning, wondering if this is simply how the rest of your life is going to feel. That exhaustion accumulates. It affects your mood, your patience, your ability to be present with the people you love. A patient I worked with, I'll call her Margaret, told me she stopped going to her granddaughter's soccer games because she was afraid of tripping on the field. She didn't tell her family why, she just made excuses. That is the hidden cost of this condition that nobody talks about. And here's what makes this even more serious. And I'll come back to this in a moment, the progression, because this doesn't stay where it is. I've watched patients who dismissed the early symptoms for a year, 2 years, and found themselves gripping walls to walk down the hallway. The body keeps sending the signal. And if we keep ignoring it, the damage compounds. Let me talk about what's actually happening in your nervous system when you feel those shocks. Because understanding this mechanism is the most important thing I can give you today. Your peripheral nerves, the ones running through your legs, your feet, your hands, are essentially electrical wiring, long, intricate cables that carry signals back and forth between your brain and the rest of your body. Every sensation you feel, every movement you make, all of it runs through this wiring. And like any electrical cable, these nerves have a protective, insulating layer surrounding them. In biology, we call that layer the myelin sheath. Think of it as the rubber coating around a power cord. When that coating is intact, the electrical signal travels cleanly, efficiently, without interruption. Now here's where it begins to break down. When the myelin sheath deteriorates, and there are specific reasons why this happens, which I'll explain, the signal doesn't travel cleanly anymore. It leaks, it misfires, it arrives distorted, or doesn't arrive at all. And that is exactly what you're experiencing. The burning sensation is a distorted signal. The numbness is a blocked signal. And those electric shocks that jolt you awake at night, those are misfires. Your nerve is trying to communicate, but the insulation is damaged, and the signal is firing erratically. This is not mysterious. This is not untreatable. And this is absolutely not simply what getting older feels like. The research is increasingly clear on this. But here's what makes this so frustrating, and why I'm so committed to talking about it publicly. The primary drivers of this deterioration are almost entirely nutritional and metabolic, which means they are addressable. But the standard 10-minute appointment gives your doctor no time to explore this with you. So they reach for the prescription pad, and that prescription, in most cases, makes the underlying problem worse. I want to walk you through the mechanism in layers because this is important. The first layer is this. After age 60, the body's ability to absorb vitamin B12 from food and standard supplements drops dramatically. The stomach produces less of a protein called intrinsic factor, which is literally required for B12 to be absorbed through the gut. So even if you're eating well, even if you're taking a multivitamin, your body may be getting a fraction of the B12 it actually needs. And B12 is not optional for nerve health. It is the single most critical nutrient for producing and maintaining that myelin sheath. Without adequate B12, the insulation on your nerve fibers slowly deteriorates, and the damage accumulates over years, often silently, until the symptoms become impossible to ignore. But here's what makes this worse, and what the research suggests is deeply underappreciated. If you're taking metformin for blood sugar management, that medication actively blocks B12 absorption. Published studies show that long-term metformin use can deplete B12 levels in up to 30% of users, sometimes significantly. So you have a patient who is already absorbing less B12 due to age, and then a medication that further suppresses what little absorption remains. The nerve damage doesn't just continue. It accelerates. And then that same patient is prescribed gabapentin or Lyrica for the nerve pain, medications that mask the sensation without doing anything for the underlying deficiency. The wiring keeps deteriorating. The patient just feels it less clearly, until one day the damage is extensive. I've seen this pattern in my practice more times than I can count, and it breaks my heart every time because the root cause was addressable. And I'll get to that in just a moment. The second layer of this mechanism involves something called oxidative stress. Over decades, the mitochondria inside your nerve cells accumulate damage from free radicals, unstable molecules that attack cellular structures. This oxidative damage is normal to some degree, but in people over 60, especially those with any degree of blood sugar dysregulation, and this includes prediabetes, which is far more common in this age group than most people realize, the oxidative burden on nerve cells becomes severe. The nerve cells can't repair themselves fast enough, and the result is progressive deterioration of the very cells responsible for transmitting sensation. The third layer, and this one surprises many of my patients, is inflammation. Chronic low-grade systemic inflammation, not the kind you feel acutely, the kind that operates silently in the background for years, damaging nerves, blood vessels, and the small capillaries that supply oxygen and nutrients to nerve fibers. Elevated blood glucose damages those tiny vessels first. And when the capillaries supplying your peripheral nerves begin to fail, the nerves are essentially being slowly starved of the blood flow they need to function and repair. This is why what you're experiencing at night is not random. It's not anxiety. It is a predictable biological consequence of specific deficiencies and metabolic stressors, most of which have been building for years. Researchers at institutions studying peripheral neuropathy have observed something remarkable. The peripheral nervous system retains a meaningful capacity to recover when it is given adequate nutritional support and the oxidative burden is reduced. The nerve cells are not dead, they are damaged and undernourished. And the research increasingly suggests that providing targeted nutritional support can allow this recovery process to begin. This isn't fringe science. These findings have been published in peer-reviewed journals for decades. But this information rarely reaches the patients who need it most. I had a patient, I'll call him Robert, 67 years old, came to me after 3 years of worsening neuropathy symptoms. He'd been to 2 neurologists and his primary care physician. He'd been put on gabapentin, which made him so foggy he had to stop driving. He'd tried 3 different B12 supplements from the pharmacy, none of which made any difference. He was sleeping 2 to 3 hours a night because of the burning and the shocks. His wife had moved to a separate bedroom because his constant movement was disrupting her sleep. He told me quietly that he felt like he was disappearing, not dying. disappearing, like the person he used to be was becoming inaccessible. What we found was what I now see routinely: severe B12 deficiency despite supplementation, because he was using the wrong form of B12, significant oxidative stress markers, elevated inflammatory markers, and a long-standing history of metformin use. When we address the actual nutritional deficiencies, using forms of these nutrients that actually penetrate nerve tissue, Robert described over several months a gradual quieting of the symptoms. The shocks became less frequent, the burning reduced. He started sleeping in 4-hour stretches, then longer. He told me later that the thing that moved him most was walking to the mailbox one morning without holding on to anything, a thing he hadn't done in 2 years. I'm not telling you Robert's story to sell you something. I'm telling you because his situation is not unique. I've had dozens of patients with near-identical presentations, and the medical system failed every single one of them, not out of malice, but out of structural limitations. 15-minute appointments, insurance-driven prescribing protocols, a pharmaceutical industry that profits from symptom management, not resolution. Because think about what this condition takes from you beyond the physical. The sleep deprivation alone is devastating. After months of fragmented sleep, the cognitive effects accumulate. Memory, concentration, mood regulation, all compromised. The chronic pain activates stress pathways that suppress immune function, elevate cortisol, disrupt digestion. Depression in people with chronic neuropathy is not a coincidence. It is a direct physiological consequence of unrelenting pain and sleep disruption. And then there is the autonomy, the identity. You are a person who spent decades building a life, raising a family, maintaining a home, contributing. You walked through this world on your own terms. And now you're gripping the wall in the hallway. You're watching where you step on carpet. You're turning down invitations because you're not sure how far you can walk, or whether you'll be able to get up from a low chair, or whether the pain will make you unable to enjoy an evening out. That is not a minor inconvenience. That is a fundamental change in how you experience being alive, and it does not have to be permanent. If what I'm sharing today is new to you, and I suspect it is, make sure you subscribe to this channel. I release critical health information for people over 60 every week. Information your doctor may not have time to share in a routine appointment. Hit the subscribe button below. It costs nothing, and it could be one of the most important health decisions you make today. Let me now talk about the specific nutritional compounds that the research has consistently pointed to in supporting nerve recovery. And I want to be precise here, because the form of these nutrients matters enormously. And this is where most people are being failed by the supplement industry. The single most important nutrient in this context is B12. But not just any B12. The form matters critically. The majority of B12 supplements sold in pharmacies use a synthetic form called cyanocobalamin. It's cheap to manufacture, and for most people under 50, it works adequately. But in people over 60, especially those with compromised absorption, cyanocobalamin is largely ineffective at penetrating nerve tissue. What the research points to consistently is methylcobalamin, the methylated form. This is the form that crosses directly into nerve cells. That supports active myelin synthesis, that the body can utilize without the additional conversion steps that become inefficient with age. I have had patients who took standard B12 for years with no effect, and noticed a meaningful difference when switched to high-dose methylcobalamin. This is not anecdotal. The clinical literature on methylcobalamin and peripheral nerve health goes back decades, and it is among the most robust evidence we have in nutritional neurology. The second compound I want to discuss is alpha-lipoic acid. This is a fat-soluble antioxidant with a property that makes it uniquely relevant to nerve health. It works inside the nerve cell itself, at the mitochondrial level. Standard antioxidants like vitamin C work primarily in the fluid outside cells. Alpha-lipoic acid penetrates the cell membrane and neutralizes oxidative damage where it is actually occurring, inside the mitochondria of the nerve cell. It also has the capacity to regenerate other antioxidants, essentially multiplying its own effect. Researchers studying peripheral neuropathy have used alpha-lipoic acid in clinical settings for decades, particularly in Europe, where it has been studied extensively for nerve support. What the data consistently shows is a meaningful reduction in the sensory symptoms, burning, tingling, and sensitivity, in people supplementing with adequate doses of the R form of alpha-lipoic acid, which is the biologically active form. The third compound is acetyl L-carnitine. This is an amino acid derivative that plays a specific role in mitochondrial energy production inside nerve cells. Think of it this way. A nerve cell trying to repair damaged myelin requires enormous amounts of cellular energy. Acetyl L-carnitine helps transport fatty acids into the mitochondria, essentially providing the fuel for that repair process. Studies in clinical settings have observed that supplementation with acetyl L-carnitine supports nerve regeneration, not just symptom management, but the underlying structural repair. The distinction matters. Gabapentin reduces the perception of pain. Acetyl L-carnitine supports the biological process by which nerve tissue can actually recover. Those are fundamentally different mechanisms. Benfotiamine, the fat-soluble form of vitamin B1, is another compound with decades of research behind it. Standard thiamine, the water-soluble B1, does not penetrate nerve tissue effectively. Benfotiamine does. And its particular relevance is to the protection of nerves from glucose-related damage. For anyone with diabetes, prediabetes, or simply elevated blood sugar, benfotiamine represents a specific and well-studied form of nutritional support that addresses one of the primary mechanisms driving peripheral nerve damage. European clinical researchers have studied it extensively, and the findings have been consistent. Magnesium is involved in over 300 biological processes, including the regulation of nerve signal transmission. Most people over 60 are chronically deficient. Dietary intake tends to decline with age, and absorption efficiency drops as well. What's relevant here is that magnesium deficiency directly increases the excitability of nerve cells. The channels that regulate calcium flow, which governs how readily a nerve fires, require adequate magnesium to function properly. When magnesium is low, nerve cells become hyperexcitable. They fire more easily, more frequently, and with less regulation, which is experienced as exactly the kind of unpredictable, spontaneous nerve discharges that produce those nighttime shocks. Addressing magnesium deficiency is not glamorous, but the clinical evidence for its role in reducing nerve hyperexcitability is solid and consistent. And finally, vitamin D. What researchers are increasingly finding is that vitamin D has direct roles in nerve health beyond its well-known function in bone metabolism. Vitamin D receptors are present in nerve tissue. Deficiency has been associated with increased neural sensitivity and pain amplification, and the majority of people over 60, particularly those who live in northern climates or spend limited time outdoors, are significantly deficient, often without knowing it. Addressing vitamin D deficiency as part of a comprehensive nerve support protocol is something I consider essential. I've put together a short presentation that goes much deeper into everything I've covered today. It includes specific approaches that I've seen work for patients in exactly this situation. The link is in the description below. Watch it when you have a quiet moment. I think it's going to answer a lot of questions you didn't even know you had. Now I want to address something that I know is in the back of your mind. If these nutrients are this well researched, if the evidence is this consistent, why isn't your doctor prescribing them? Why isn't this the first conversation you have at the office instead of the last? This isn't a conspiracy. It is a system problem. Medical education in the United States dedicates a fraction of its curriculum to nutritional medicine. Physicians are trained primarily in pharmaceutical interventions, and the reimbursement structure of modern medicine rewards procedures and prescriptions, not lifestyle and nutrition conversations. A 15-minute appointment leaves no room for the kind of detailed explanation I've given you today. So your doctor reaches for what the system has trained them to reach for, a prescription that manages the symptom, gets you out of the office, and technically satisfies the protocol. The result is that millions of people over 60 are suffering from something completely preventable. And the information that could help them is sitting in published research that nobody has had time to translate into plain language. That is why I do this. That is why this channel exists. You deserve the same conversation that my patients get in my office. And you deserve to make decisions about your own body with complete information. You are not powerless here. Your body has a remarkable capacity to respond when given the right support. The peripheral nervous system, unlike the brain, has meaningful regenerative capacity. Nerve fibers can remyelinate. Cellular energy can be restored. The inflammatory environment that has been damaging your nerves can be addressed. This is not theoretical. I have watched it happen in patient after patient who finally received the nutritional support their nervous system had been lacking for years. The next time you lie awake at night and feel that electric jolt through your leg, I want you to remember what I explained today. That is not a mystery. That is a misfiring nerve signal from damaged insulation. And that insulation can be supported. The burning in your feet is not your fate. The numbness is not the inevitable cost of getting older. These are signals from a nervous system that is undernourished and overburdened, and that is waiting for the support it needs. You still have time. The research is clear, and now you have information that most people your age will never receive. If today's video opened your eyes to something important, share it with someone you care about. Because there are millions of people over 60 dealing with this silently, and they don't have to. The short presentation in the description goes even deeper. I highly recommend watching it when you have a quiet moment. Subscribe for more critical health information every week, and leave a comment below. What was the most surprising thing you learned today? I read every single one.